to show you a technique that we use when we're going to do knee arthroscopy under local anesthesia. What I'm going to do now is put sometimes the patient moves. Can you hold them over here? Please hold his focus. Sometimes there's a reaction. Just push down. Sometimes the patients kick a little bit. They kick sometimes, but not too much because did he get any fentanyl?
A little bit.
Yeah, see, he also got a little bit of fentanyl. So that kind of keeps him from kicking. Okay, number one. And then what I do is I go like this. And he's already ready to go for these other two injections. These injections are very important. Okay, inferior patella. This is where my portal site is going to be. I inject all the different layers. Sometimes it squirts, you got to be careful. Aim at the notch. Boom, right into the notch. And then I go up a little bit to get the fat pad. And then more importantly, medial capsule. Okay, medial capsule like this. Poke, poke, poke. Get this really well because the patient is going to be waking up in a few minutes here. And I'm going to be putting a camera in here. And the patient is going to be wide awake. Now how does that happen? Well, number one is he's done that pretty well. See, I can't do this with a patient awake. It would hurt. This is an 18 gauge needle. 60 cc's of local. I'm injecting this in the path of my future scope. My scope is going to go into the patellofemoral joint. It's going to go into the notch. And then, like I said, the capsule. Okay, there's some capsule right there, the meniscus. And get all of it in there. It's all in. Now, part two is the most important part, or another important point about this is not to give the patient Versed, because if you give them Versed, they're not going to have any clue where they are, and they're going to fight you at every point during the surgery. So once again, this is how local anesthesia is injected in preparation for knee arthroscopy under local. A little bit of propofol, a little bit of fentanyl, no Versed, inject intra-articularly 30 cc's, 15 cc's in the direction of your portal, compress, and I think the money is putting it down, going to scrub, coming back, and that gives it about 10 minutes to set, and you can start arthroscopy wide awake. That's it, thank you. So we're inside the knee, the patient is prep draped, we're inside the knee right now. Sir, are you feeling comfortable?
Am I feeling comfortable?
Yeah.
Yes.
Good, okay, thank you. But you're pretty wide awake, is that correct?
Yes.
Okay, and you're feeling pretty comfortable right now?
Absolutely.
Okay, well, thank you so much. So what I'm gonna show here on the screen, we're in the joint, okay? And as you know, I just videotaped a little earlier. About 15 minutes ago, we did the prepping and draping, and then I washed. They actually draped. Then I came in, and the patient was still a little sleepy when I put the camera inside. But then after about 5 minutes, he woke up. So I'm just in the patellofemoral joint. I'm starting the procedure, and he's wide awake. So I just wanted to show you how it's possible. Okay, so remember, you have to be gentle at this point if you're going to do this. Thank you so much. Over and out. Dr. Mora talking about local anesthesia for knee arthroscopy.